Who's sitting in front of me again? Isaiah Lou. Boom! He starts going off to me again. I said, let me get the hell out of here. I'm not up for this stuff yet. Then he sat down, and before the day was over, he wanted me to visit him in his office. Already I had a much bigger practice than he had, and he wanted me to come in and work with him.
Where was your practice then? Where were you practicing?
In a basement.
Your big practice is in a basement?
Well, that's what, yes, sir, in Kew Garden Hill, 7117. In fact, I made the numbers, 150th Street in Kew Garden Hills. It was down in the basement of an apartment house. So he wanted me to be up there and work into a partnership. He was on 54th Street at the time, right off Park Avenue, 5th Avenue. So no, then I became very, very friendly with him, and we had a great deal of respect and admiration for one another. In fact, one time he was up there, and he was giving a big lecture to a great group of people, and I was way in the back. I didn't even know he knew I was there. And he said, see this case, the only one that possibly could work this one out would be Linkow. And I almost fell
wow.
for it. Yeah.
Tell me about your first lecture. That was pretty fun.
And that was in 1954, I think it was, in the Central Queens Dental Society, right on
you had to have a certain amount of people in the room, and you didn't.
That one. That's a different one.
Now tell me.
I'll tell you about that one. Yeah, I was still in the basement working at this time, and
you just spoke to about 1,000 people.
Who did?
You did. I mean, you always speak that there's 1,000 people up there when every meeting they're up there.
Oh yeah, but this is.
I know. So I just want to get reference.
So what happened was this is. Man, I never walk out of this room if I'm telling a lie, and I'm not a guy that lies, nor do I BS when I'm lecturing up on a podium. Okay, so I get a call, First Citizen Dental Society, to give a one-day course finally in New York, Manhattan. First, I said, I was thrilled. I felt like like a king. So I'm going on, working. Then the day before, of course, I decided to call up and find out how many doctors I have. I'm Dr. Linkow. I just want to know how many students do I have at the course. She says, just wait a minute. She goes back. So I'm sorry to say you don't have a single one. Well, I almost fell through the floor.
The worst nightmare for a speaker.
So I had this old man Weiss. Not Charlie Weiss, old man Weiss. So I let him use the office, and I got a hold of him. I said, Jack, you've got to get me. So I said to her, the woman there in charge, I said, well, how many do you need to have the course go? She said, you need 5, and that's up to the lecturer if he wants to continue. I said, okay. So I got Jack Wimmer to get me 4 other guys, which I paid for $50 a piece with my own money. And so help me God, that's $250 I laid out.
That was tough.
And I gave, it sure was. And I gave the course, the one-day course. Then after that, there was one fella in that course. He was a big shot in the politics of the First Citizen Dental Society. Sam Myers, his name was. He was about 15 years older than I. And don't you think they had him give the courses after this? Because I was too controversial. They wouldn't let me give a course. Yeah. And one time he calls me up on a Sunday, says, Lenny, you got to help me out. I said, what's the matter? He says, I put these needle implants in on this patient in the molar, and every time he picks his nose, he cuts his finger. So I said, for Christ's sakes, do you know how long those pins are? They're 1 inch long. You probably went right into his nasal vestibulum. So I had to go up there on a Sunday and pull the damn things out. But he was the one who was giving the courses.
So,
I had a lot of arrows in my back.
I bet. Yeah. You know, I know you're writing a book on the history of dental implants. And so how many books have you written?
This will be my 14th.
14th.
Or 15th. I don't remember.
14, 15. I want to go over some of the people that but what I'm really curious about is when you look back at your career, what are the 3 things that you think have been your greatest contribution to the field?
Simply, when I came out, see, nobody wants to give me credit for that. It's amazing. But my vent plan implant, which I came out in 1963, that was the very first self-tapping screw ever. In other words, before my vent plan, actually in 1963, that's where all the geniuses came out. Stefano Tremonti from Milano had his own screw. Giordano Muratori from Bologna had his own screw. Raphael Sheshev from France has his own screw. Every one of these screws, and Sammy Sandhouse from Switzerland had his own screw, they all had to use a tap to tap the bone first because they were not self-tapping. Well, I built the tap into my vent plant screw and introduced it in 1963. It was the very first one. And that's why the way I had it designed, of course I had it. And I had 37 patents altogether. And I'm one of the guys who never made any money on nothing. It's a joke.
I
was never a businessman. I was too busy working on my patients, and trying to prove that that implantology one day would be a great discipline. I never dreamed it would be this big, but
okay, so that's number one. What's number two?
Number two is when I came out with my immediate load blade. These were all immediate loaded. Like my vent plant, the way it was designed with the large open vent and the sleuth waves, so that when you screw that into the bone chips would slide down the sleuth waves and deposit itself into the vent. And then if the vent got filled up, then the sleuth waves would get filled out of the bone. So there was no bone surrounding the threads of the implant. Therefore, there's no pressure on or compression of the surrounding bone. That's why I was able to put them into immediate function. And then the third one was my tripodal subperiosteal implant.
Yeah,
in 1984. Yeah.
So, immediate load is. We did Mish and I, when I was president of the AID, we did a consensus conference on immediate load. And so when were your first thoughts on immediate load?
When I came out with my vent plant in 1963, I was doing, before, 1952. With all my subperiosteal implants, it was immediate load because I would get back from the laboratory, the subperiosteal implant and the overdenture. So the implant would go in, suture it up, and the overdenture would go right on. So it's immediate load with the subperiosteal.
So really, the original development of implantology was all immediate load, wasn't it?
Not necessarily. Like Shishev, when I used to go over there and teach with him over in Larry Boisier Hospital in Paris, he put the screws in and let them hang all over the place. That's why he had so many that failed, you see, because he never splintered them together, you see. But and then when I came out with of course, as I said, and then in 1963 when I came out with the vent plant screw, it's immediate load because the way I designed it.
What were the post-op instructions?
Oh, we used to give him a sheet of paper, no crackers or toast, anything hard, eat soft foods, drink a lot of liquids, rinse your mouth out all the time.
What made you go forward on the design of the blade implant?
Oh, that's a good question. You're talking about flapless surgery. I mean, I was doing flapless surgery in the 63 with my vent plant screw. I was not that I was afraid to open up the tissue because I was opening up for all of my subperiosteal implants. But I saw that some of the ridges looked wide enough where I could go right on through, So first I used a hollow mill trephine to get the plug of tissue out to prevent epithelial inclusions from occurring, you know what I mean? And then I drilled right on through and put my vent plant screws in and put them all around and have a prefabricated temporary splint. We'd have it made up right away from the laboratory, or I'd do it right at chairside. So they walk out immediate function. I didn't use immediate load, I used the word immediate function, okay?